one of the key points we want to make is that cultural humility, in other words, coming from a point of not knowing and curiosity, is really important with people of any ethnic group, but with Native American patients as well. And that's a distinction from cultural humility to cultural competence, which we talk about in our session. But that there also can be as much differences between members of tribes as between tribes and between Native people and other ethnicities. So not to make assumptions, but to stay open and curious.
With the very rural population spread throughout the state, we have about 224 tribes that are very different from each other. So when we're talking about advanced care directives and advanced care planning, how do we reach those people in these remote areas and start to have that conversation about being prepared?
The providers, medical providers, and our patients that we serve have very different kind of competing agendas. And so it was important for us looking forward that we create kind of a way to have the conversation that it makes sense for the providers as well as the patients that we're engaging.
And oftentimes providers don't feel comfortable, they don't even know how to start the conversation. And what we realized is that for patients, having an advanced care planning conversation was really important to them. And when you put it in terms that they could understand, such as being prepared, that preparedness and knowing that just as we're prepared for taking a trip, or in Alaska, subsistence activities such as hunting or fishing, people understand the importance of being prepared. Our conversation map is a picture of a river and a guide. And we equate that river and that guide as kind of being that journey through whatever's going on, that serious illness. And there's so many different pictures that are symbolic of that journey. And what's wonderful is it's a picture that opens up that conversation, and every patient and family member relate to those pictures on that conversation map in a different way, but it opens up their story.
And that conversation guide too, when we first developed it, there were people that were giving feedback. Of course, we were asking for tons of feedback, and one of the biggest questions was, why aren't there words on it? Mm-hmm. And it's very purposefully just illustrated. And really the intent was, it was illustrated with intent, and it was created with intent that it's not provider focused, that it really truly is that patient telling their story. What might be rocks in a river for one person could be finances. What might be rocks for a river and the other patient might be pain. And so really having them to define what their rocks are, what is important to them, has been probably one of the biggest successes of that.
And so our hope is that if we all work together and we collaborate, and we create resources and tools that can be freely shared, our hope is that there can be communities internationally who could take these materials and augment them for their own cultural setting and be able to implement them.